Hi, I'm Nicole Birch, a genetic counselor at the Community Health Clinic. We're going to be covering the topic of recessive inheritance. The term inheritance refers to how genetic information, our DNA and our genes, gets passed on from parents to their children. There are many different patterns of inheritance, and recessive is one of those patterns. In general, there are 2 copies of every gene in our body. We get 1 copy from our mother and 1 copy from our father. There are some exceptions to that rule of 2 copies, but it doesn't really matter when it comes to recessive inheritance, so we'll set that aside for now. Genetic conditions are caused when there are variations or mutations in the spelling of a gene. Some genetic conditions require there to be just 1 variation in 1 copy of the gene, and other conditions, the recessive conditions, require there to be a variation in each copy of the gene, the copy from mom and the copy from dad. When a person is affected with a recessive genetic condition, that means that each copy of the particular gene, we'll call it gene A, has a spelling variation. This means that 1 copy of gene A with a variation came from mom, and the other copy of gene A with a variation came from dad. In this scenario, the parents are each called carriers of that recessive condition. Being a carrier means that there are 2 copies of gene A. 1 copy has a variation, but the other copy does not. And that's important because for a recessive condition to actually cause symptoms, both copies need to have variations. So again, a carrier is someone who usually doesn't even know that he or she is a carrier, but carries along a copy of a gene with a variation. And a carrier can potentially pass that copy of the gene onto his or her child. But the carrier could also pass on the working copy of the gene, the one without the variation. When a couple is each a carrier for the same recessive genetic condition, this sets up 4 possibilities of how those variations can get passed on to their children. These 4 possibilities are the same for each pregnancy and do not change based on the child's gender. The first possibility is that the mother would pass on her working copy of the gene, and that the father would pass on his working copy as well. This would result in a child who is unaffected with the condition and isn't even a carrier, because the child has 2 completely normal copies of that particular gene, no variations in either of those copies. The second possibility is the mother would pass on her non-working copy of the gene, the copy with the variation, but the father would pass on his working copy of the gene, so that child would be a carrier. The third possibility is that the mother would give her working copy of the gene with no variations, and the father would give his copy with a variation, the non-working copy. Then that child would be a carrier too. The fourth possibility is that the mother would give her non-working copy of a gene, the one with the variation, and the father would give his non-working copy as well, also with a variation. This child then would have inherited 2 copies of a gene, both with a variation, and would therefore be affected with that particular recessive genetic condition. Since there are 4 possibilities, this means that there's a 25% chance with each pregnancy that the carrier couple would have a child who is affected with the particular recessive condition associated with variations in that gene. It's important to note that the chance of having an affected child when a couple is a carrier for the same condition is not 100%. That's a common misconception. Again, there are other patterns of inheritance, but hopefully this video has helped you learn more about one pattern, recessive inheritance.